Israel calling this a new phase of their war. How concerned are you by the prospects of escalation at this point, and what can the ministry do to prepare in that eventuality?
Well, there are two main concerns. Clearly, one of the concerns is an increase in the aggression on Lebanon and resulting in a large number, even more number of casualties. Clearly, this is a big strain on our health system, which is a health system that has been coping with multiple previous crises, financial crises, COVID, port explosion, migration of almost a third of our doctors and nurses. So clearly we are concerned. Now, the other thing of concern to us is the type of attacks, which, for example, yesterday it was an attack on a lot of people where they were at their homes or at work or even involving children. Two of the fatalities yesterday were actually an 8-year-old girl and a 11-year-old boy. Also, another concern, we're having or we're seeing is the number of healthcare workforce that have been targeted. Just 10 days ago, 3 of our firefighters, while putting out a fire in the south, were targeted and killed. And in my opinion, this type of attacks that go outside the rules of war, so to speak, or the international humanitarian laws, where people in their civilian conditions are being targeted and attacked indiscriminately, means also that you don't know what to prepare for. The preparation for this becomes even more difficult.
And Doctor, it's not lost on us, of course, the situation that Lebanon faces right now. The economy has been in free fall. We've heard repeated calls for IMF assistance and IMF reform. Do you have the resources that you need right now in order to treat those injured and to provide the care needed if we see this situation escalate further?
We are working in a low-resource environment. There is no denying that. And that's why, the help that is coming to Lebanon is much appreciated. We've had help coming from some of the international organizations, UN agencies. We've also had help coming from some of our neighboring countries. But also what the ministry have been doing is doing better preparation to allow better utilization of resources. So, for example, in the attacks that we had 2 days ago, we have been drilling our hospitals for almost a year now on how to receive mass casualties, how to triage them, and how to manage. And I think that a lot of that preparation, what went into this disaster planning, disaster management, has helped us a lot in where we were able really to receive almost 3,000 patients in a matter of around 1 hour. I think that, but however, if there is a major escalation, it will put a major stress on the health system. There's no questioning about that.
And is that what concerns you the most right now?
Of course, and and that is why I think even our government, the position of the Lebanese government has been very clear from day one that Lebanon does not want war. Of course, considering our conditions, I mean that's something very clear. But also, we think that we need to have a way to be able to maneuver out of this predicament. And that's why, from day one, we've believed that a diplomatic solution is the best option, and a ceasefire from Gaza to Lebanon would be that solution. And I think this is also now has been, what the international community is calling for. But unfortunately, the escalation that we have seen in the last 2 days, I would even call it a provocation. I'm not sure that this is, is going to help us reach that diplomatic solution.